Good evening, everybody, or if we've got some people coming on from the US, good afternoon. My name's Simon Ramshaw. I'm the Managing Director of Erchonia Lasers Limited. We're based in the UK, and I run the Erchonia business in Europe, or should I say my team and I run the Erchonia business in Europe, Middle East and Africa. I know many of you, I think that's on the call. You know, Lunula was the first laser I actually took on with Erchonia back in 2012 when I was a consultant. So I launched it in June 2012. And even though, you know, we handled the whole portfolio of lasers, including the pain and healing lasers and fat loss lasers, Lunula will always be special to my heart because I was the one that first launched it. So on that note, conscious that people probably want to get off to have their dinner after this this webinar. It's titled Erchonia non-thermal laser, a game changer for podiatry. Now there's huge education that's been needed across this side of the pond. A lot of practitioners and doctors over in the US understand a lot more about laser technology, about photochemical versus photothermal. You know, being able to deliver a specific amount of electron volts per photon to create a photochemical response. But very much over this side of things, this side of the pond, there's a lot of education still needed. So we try to do our best to try to bridge that gap. If you look at the likes of Walt guidelines, they're still sort of a little bit in the past with regard to laser. And as we know in everyday life, things, you know, go forward on an ongoing basis, and it's a case of trying to keep abreast of new changes and new technologies. And I think patients deserve for practitioners, doctors to understand everything that's on the market, and then whatever they decide to go for is completely down to themselves. So on that note, I would like to introduce you to who has become a friend as well as a colleague, Miss Simone Paul, who is the founder of Footlift London and Footlift Medical Pedicure. Now, before Simone, I hand over to Simone, I'll just give you a little bit of background into her history. Simone's a podiatrist and visionary founder of Footlift London and the Footlift Medical Pedicure, with a deep belief that consistent professional foot care is essential for overall health and well-being. Simone has built a reputation for delivering expert treatments that go beyond aesthetics to support foot health at a medical level. Her innovative approach combines advanced techniques with a commitment to client care, ensuring that every treatment is both therapeutic and transformative. Through Footlift London, Simone continues to set new standards in foot care, helping clients maintain healthy, beautiful feet for life. So on that note, welcome, Simone. Nice to see you.
Hi everybody. Thank you so much, Simon, for that amazing introduction. I do appreciate it. And yeah, we'll get started with the webinar. I'm just going to turn the camera off, and then I'll turn it back on at the end.
Whilst you're doing that, I'll just inform the attendees who are on if they have any questions. If you look at the panel on the right-hand side, you will see a questions link and also a chat link. So please feel free to reach out and ask any questions. Quite a few of you, I think, are on a WhatsApp group that we have as well. So also feel free to share any questions on there. So I will also put my video off and I'll mute my end. And then Simone, I'll rejoin at the end of your presentation and we'll take some questions. Or would you prefer me to ask you the questions ongoing?
I really don't mind. We can do them at the end if you want, and I'll leave a bit extra time. Is that okay?
Yeah, that's no problem. Okay, right. Thanks, Simone. I'll zoom out now. Thank you.
Okay, thank you, Simon. Thank you so much. Okay, guys, so thank you again for joining me this evening. By the end of this webinar, I hope to share some knowledge and I hope that you'll be able to discover Erchonia's effectiveness in treating onychomycosis and common foot complaints and conditions. We're going to review some real-life cases that we've seen at my clinic and that my team have seen, and the successful treatment results. And then we're going to gain some practical tips on incorporating cold laser therapy into your clinic. Okay, so just a bit about me. I do quite a lot of things. I worked in the Middle East from graduated in 2011 from UEL, worked in the Middle East from 2013 to 2019. and I've mainly worked in private healthcare. I only worked in the NHS when I actually moved back from the Middle East. So it was always very important, you know, the passion that I have for feet was very important because diabetes in the Middle East was very prevalent. But when I moved back, I wanted to do something a little different. I wanted to make foot care quite therapeutic. I wanted to get real results, and that's when I developed the Footlift in 2020. I started my business in COVID, and I was mainly doing home visits because all of the salons were closed due to COVID. So actually that's when I think the business really took off. We became quite popular because people weren't getting their regular pedicures, so we would go to people's houses and do amazing treatments for them. I am a partner of a vitamin company called Zuki, and I'll speak to you a little bit more about them as we go in the presentation. I work at Third Space Medical, and that's in Soho. And Until is the building that we rent our rooms from. So we've got rooms in Marylebone, in Liverpool Street, and we've got Soho Until, and that's the name of the building that we work from. And then the other end of Soho is my Third Space Medical practice. And we've got an amazing team as well. So I finished with the NHS in June last year, just because it was very difficult to manage private and NHS care. I was only ever part-time, but I had worked in the Whittington and also CLCH, and I absolutely loved it, and the experience was invaluable. Okay, so the lasers that we have at the clinic, so we've got the Lunula and we've got the Accelerate. Now this is the kind of old style of the Accelerate, but I just want to let you know that I purchased the Lunula first just because my interest is mainly biomechanics, foot pain. I've always been quite passionate about helping people with their foot pain. But we started to get a lot of people that were coming in for the medical pedicures, and a lot of them had fungal infections. So I did decide that it would be amazing, and spoke to Simon about getting the Lunula, and it was great. The reason why it's been such an amazing treatment modality and an amazing service to offer the clients is simply because it doesn't just treat one thing. I think you can actually be quite creative with podiatry. So we've used the Accelerate to treat plantar fasciitis, Achilles tendinopathy, metatarsalgia, but then we've also used it for ulcers, for bursas, for stress fractures, for plantar tears, for even acute gout attacks. That does help to reduce the pain. Obviously, that's an internal issue, but we have seen some great results. We've also used it on eczema and psoriasis patches. I know the EVRL is mainly used for the dermatological issues with the feet, but we have seen great results with the Accelerate. In terms of the Lunula, so I'll just touch on that. We're going to go through onychomycosis, tinea pedis. We've also used it though for metatarsalgia, neuropathy, acute gout attacks, and bilateral HAV pain. So I believe that we've had amazing results purely because we're trialing lots of different things. So I established that it helped for metatarsalgia and intermetatarsal bursitis when my client with a fungal nail condition came in for Lunula, and she said that her bunions didn't hurt her anymore. So obviously with it being an anti-inflammatory device with the violet light, I think combining those two lights and with it being cold, it does reduce inflammation. And so I was very happy with the results, and so was the client. Okay, so what is onychomycosis? It's a fungal nail condition. It's one of our most common foot complaints. We have clients that have had fungal infections for years. I mean, I think probably 20 years ago, if you went to the doctor with onychomycosis, then they would put you on very harmful and quite toxic antifungals. And I've seen clients that have been on them, it hasn't really done anything apart from make them feel very sick. But there are, as I've researched this more, and I work with amazing nutritionists, And when you get the full medical history from the client, you do establish that there are many different reasons as to why clients may present with onychomycosis. So kind of just summarised it: gut and stomach conditions. So poor gut health and a leaky gut, it can weaken the immune response. It then becomes harder to fight fungal infections if there's an imbalance of bacteria. So peripheral vascular disease as well. So PVD, obviously that does and can affect the circulatory flow to the feet. So it does reduce the blood flow, which means that there's fewer immune cells, passing around. There's less oxygen, which means that the toes can sometimes become very vulnerable. The nails can become brittle and break off. Toes are often cold, which means that they get stiff. The nails then get thicker, and it just becomes a bit of a vicious cycle. Obviously, diabetes, and that creates a perfect environment for fungal nails, because the sugar and the excess glucose floating around in the bloodstream is a perfect environment, and the fungal infection, the fungal pathogens and the dermatophytes do feed off that. So at the top there, we've got Candida and Trichophytum rubrum. So those are the main pathogens and fungal elements that are cultured. There's also, if the nail looks particularly green, then it's likely that there's a Pseudomonas infection. I get asked all the time, do I send for cultures? Not really, because if the nail is smelly, if the nail is thick, if it's crumbly, then it's pretty much a fungal infection. I will only send off for a culture if we've tried everything and nothing's getting better. And I did that once, and we cultured zoophilic bacteria, so the client then had to go on antibiotics. So yeah, it's Candida and Trichophytum rubrum. Those are the main pathogens and dermatophytes that are cultured. Okay, so that's me. So I'm often, because I'm quite passionate about the laser and what it's done for my clinic, I'm always quite happy to spread the word about how effective it's been for us. And so that's me at the conference. It's really important to make sure that when you're putting a client on a course of laser, you are responsible to manage the care as best as you can, and you do have to manage the feet as much as possible. So you have to manage them as well. So it is important to encourage really good hygiene. So some of the external factors that cause onychomycosis, so a sweaty old trainer that's never been changed for 2 or 3 years, that's going to create a lovely environment for fungal elements to thrive in. And you'd be surprised, a lot of clients don't actually realize that that could be exacerbating the condition. They might not realize that not changing the socks every day is the reason why their feet could be, itchy. So general hygiene, washing the socks on a 60-degree wash, making sure you moisturize the feet. I developed a product called the Cleansing and Hydrating Nail Drops. It's a natural oil. And what it does is it helps to hydrate the nail, but it does also have lime, spearmint. It's really natural. It's got tea tree in it. It's mainly made up of tea tree. And because it's diluted in almond oil, it works very well for hydrating the nail. So nail hygiene is incorporated into our treatment. So that simply means that when we bring them in, when we bring the clients in for a Lunula laser session, that not only do we do a medical pedicure, but we will clean the nail as much as possible with hydrogen peroxide, with saline. We'll use sterile gauze on the affected nails. We'll drill them down as much as we can. And then what we'll do is we'll put them into the laser, and then they'll have their laser session. We'll take the feet out of the laser, and then what we'll do is we'll do another post-op. We'll apply some product, whether it's M-Trix, followed by our cleansing and hydrating nail drops, and then we will ensure, and this is absolutely important, that they go into a brand new clean pair of socks. And that's why I have loads of stock of socks in the clinic, because there is no point in putting the contaminated socks on. So all of these different factors are really important. So filing and burring the nail down as much as possible, antibacterial cleansing of the nails, and all of the nails should be treated in the same way. If they have a fungal toenail and the nail next to it is non-fungal, then you will still have to make sure everything is clean. So you're not just treating one nail, you're treating the whole foot. So by combining these podiatric traditional techniques and with the laser, it does really improve the appearance of the nail, and it does give amazing results. So the effect on the client. So we've had clients that have been unfortunately really upset. They've come in, they don't really want to take their shoes off. They feel embarrassed about the appearance of the nail. They don't want to take their shoes off, especially when it gets to summer. It becomes a bit of a vicious cycle because the feet need to be exposed. They're not taking their shoes off. They're ashamed about their feet, so they're constantly covered, and obviously that's just making things worse. So I think it's really important when you do get a client that's upset about their nail that you make them feel as comfortable as possible and just say it's a really common condition, and we'll do our best to treat it for you. I never promise that we'll be able to completely eradicate it. We'll do all that we can in the clinic, but they also have to make sure they manage their foot and nail hygiene as much as possible and look after their feet, and it's our job to tell them that. Okay, usually the topical nail treatments, I'm sure we all know Curanail, Emtrix, it used to be called Losarol, I think. They may help to minimize the appearance of the fungal nail, but you find that clients are using it for years and years and there's been no real result, and that's because the fungal elements are stuck right down in the nail matrix, and that's what the laser helps with. It actually penetrates and causes the nails to grow out naturally just because of the light. We'll go into that a little bit more. Okay, so tinea pedis, really quite important if you're treating a fungal nail that you aim to treat the athlete's foot as well, because it's going to be a case of cross-contamination. So I always suggest that clients get the athlete's foot under control if they present with a fungal nail. Why? Because if we don't treat that, it's going to take longer to treat the fungal nail because of the environment, and it's the same dermatophytes and it's the same Trachophytum rubrum that affects the nails, that affects the skin. So get that under control as much as possible, and that could mean that you need to recommend that they get some Dactarin. You're applying Dactarin when they come in. So that's really important because itchy feet, it's not comfortable. And if the client is scratching, that's another portal of entry for fungal elements to get in. So controlling that is really important. And what we found is in between the toes, if you have those really macerated interdigital spaces, the Lunula works great for that. And it does tend to just create less of a moist environment and you get really good results. Okay, so I'm just going to get into the cases now, and these are real cases that we've seen in the clinic, and I'd just like to let you know that consent has been given by the client. I'm not sure if some of you tuned into the last webinar that I did last year, but we weren't able to hear some of the cases, so we've got some new and some old ones, and hopefully you'll be able to get an understanding of some of our clients and the success rate. So onychomycosis affecting the left foot. So this is a 38-year-old full-time carer. Okay, so this particular client, I kid you not, she didn't want to take her shoe off. She'd been referred, she'd heard about us on Google, and she did not want to take her shoe off when she came in for the initial assessment. She was so embarrassed about it. So there was a bit of trauma. So a bike had run over her toe, but there was a history of fungus. So it started off with her small nail, and then she had the trauma, and then all of the nails got affected. But she does have essential hypertension and a leaky gut. So already I'm thinking, right, okay, there's some fungal, you know, issue going on potentially with the bloodstream. It might just not be due to trauma that this infection has started. But this infection got worse because for 5 years she just kept on putting, you know, antifungals on. She was put on some antifungals from the oral antifungals from the GP. And it didn't help, so it was a last resort. She hadn't seen a podiatrist before, so she didn't know what to expect. So essentially what we did, so whenever we have a nail that's completely covered like that, when it's wet underneath, when it's a little bit smelly, we get rid of that, usually with a tungsten burr. We'll cut that down, we'll get rid of as much of the damaged nail as possible, and we'll start from scratch. So the nail will look quite thin, but it's essential because we have to make sure the laser penetrates. So there's no point in bringing a client in and putting them straight into the Lunula like that. You do have to burr that down as much as possible. So you need at least a half an hour appointment before. And you don't have to do that every single time, but it's important to make sure before the initial session that those nails are burred down as much as possible. Okay, so with this particular client, obviously sometimes compliance is an issue. She unfortunately fell ill, so we had to do more laser sessions just because we weren't getting those results. So initially I brought her in for 4 laser sessions on a weekly basis. We got her to apply the cleansing and hydrating nail drops. Then there was that 3-month gap, and then we did an additional 4 weekly sessions of laser. So she would be coming in between the laser sessions. She'd be coming in for our Footlift medical pedicure, so nail cutting, filing. We did put her on some Zuki, which I will speak about later. So Zuki is essentially a probiotic, and that does help to balance the bacteria in the gut. So instead of putting your clients on, if all else fails, like instead of referring them to go to the GP, ask them to get a probiotic. And I would recommend this one because it does have clearance, and we've had some great results with it. Okay, so we're just going to see. So this is what kind of now looked like after the first session. So we drilled everything down, it's starting to grow back, and we have a very positive result. And this is actually a combination of the client being really compliant. You know, at the end of the 4 sessions of Lunula, she couldn't get into us, but she was using the products. She was making sure that her hygiene was correct, and the nails look great. And she was really, really happy with the results. Now, that is not a result that you're going to get after 2 months, okay? The whole nail has to regenerate. So that's why we take close pictures, and we're monitoring the growth. And the good thing with the Lunula, it does speed up the nail growth, okay? So that violet light and the red light, what it does help to do is stimulate the blood flow to the nails. So actually the nail rate growth is a lot quicker. So that's really good. And obviously that's the before and after. So some really fantastic results, and actually her feet still look the same, and we're really, really happy, and so is she. So she can now wear sandals, she can now, you know, feel comfortable instead of hiding the feet away. So yeah, really great results. And yeah, she's just going to say a few words. I hope you guys can hear this. Simon, let me know if you can't hear. Okay, so we're just looking at the toes. Okay, hello Chantal.
Hi.
Yes,
so
I can hear.
You've just got 8th Lunula laser.
Yes,
And are you happy with the results?
absolutely. I'm so happy. I thought I would have to have much more laser after having a traumatic accident with my foot. I did not look after them. I think I was more ashamed of the bruising, and it just got worse and worse and worse. But coming to you made me feel comfortable. Being able to use your products helped as well.
Okay.
And I'm more confident now too.
Okay, so yeah, that's just to show you And then we're just going through some other cases, all different. So this was a tricky one because there was such strong malodor, so discoloured and painful nail. A 41-year-old tech manager and volunteer. She just became a mum as well, so she's convinced that the pram went over her toe, or a blunt object. She's always rushing around, but it was so painful to cut through, and there was a load of pus, and it looked like the nail wanted to come off. So we were able to cut down as much as possible, but you can just see that that's lots of onycholysis. But there was definitely some Pseudomonas in there because there was a smell underneath the nail bed. But it had been for 3 years, so there was lots of dirt trapped underneath, some foreign objects and bodies, loads of sand in there because she was living in LA. So 6 Lunula laser sessions, 1 week apart. That's all she needed, and that's what I recommended. And this is 4 months after the last laser session. So the additional treatments, again, monthly medical pedicures, the application of cleansing and hydrating range, and we did advise her to purchase a tube of Emtrix and finish that. So you're supposed to put the Emtrix on the affected nail once a week. And as you can see, the nail is okay, and again, it's completely regenerated, it's pink, it's healthy. And that was through the Lunula that we got those results, and with good nail care and good hygiene. Okay, so I think I've shown this one before. That's an onychogryphotic nail due to some trauma. It's the 1 digit, so a blunt object landed on the toe. And this particular client, her toe or her foot was stepped on by a horse. This is one of my clients from the Middle East. And as you can see, lots and lots of bleeding. It was very painful, and we were able to get really good results, but I haven't been able to follow this client up. But the last time that we did see her, we were able to take this picture. There's still some discoloration in the corners, but this is after 4 Lunula laser sessions. But we were seeing her once every 2 weeks due to availability. And again, that's putting the foot in for 12 minutes. We also always put the other foot in for 12 minutes as well, just because of cross-contamination. And again, client was using our cleansing and hydrated nail drops. She was washing her socks on a 60-degree wash, and she was coming in for regular nail care when she was coming in to see us, okay? So it is important, if you do lose some clients to follow up, just drop them an email. It's really good service to say, I just wanted to check how your nail was doing. If they're not happy, just bring them back in, have a look, take some pictures, always compare so that they can actually see the difference. Okay, so I just wanted to show you the stages of recovery when using the Lunula laser on a bruised and fungal nail. So quite a tricky case, because even though we'd booked all the clients in, I like to get clients in for Lunula on a weekly basis. I just think it finishes the course quicker. You're able to clean and manage the nail, and by the end of the 4th session, you're starting to get some healthy nail growth. But this particular client, even though I told her not to, she was consistently putting gel on between the appointments, which of course it didn't help because we had to cut the nail down, but then she didn't like how it looked, so she kept on putting gel on. So eventually we did get her to take the gel off. We cut this down and drilled it down, but this took, I think at this stage, so the second, right, I hadn't seen her for about 3 weeks, but again, 10 Lunula laser sessions, it was about 3 weeks apart because we just weren't able to get her to come in on a weekly basis. And some clients can't manage that. There's life, there's work. But as long as you give all the right advice, but as you can see, the nail starts to look a lot healthier. And then finally, it looks nice and clear at the end, and it has stayed like that. And this was about 2 months ago that I took the final picture. And again, client is very, very happy with the results. She no longer puts gel on. She's quite happy for us to do the foot lift on her when we buff the nails. And that way there's less bruising, the nail bed is not getting suffocated, and it just looks much better. So that's really, really good. Slightly different case with this one. So this is itchy psoriasis affecting the plantar aspects. And this is my colleague that I work with, sent it to us. So what we would do is we did medical pedicures for her, which involves exfoliation, just gentle exfoliation, because you can see that it's very, very red. During our medical pedicures, we have a medical pedicure and we have a foot lift. During the foot lift, we do a complete transformation of the feet, but then we apply a warm collagen mask to the feet, and that's a combination of shea butter. So we warm that. It's a combination of shea butter and avocado oil, and then we paint it all over the feet. You may have seen it on our Instagram. But what we were doing is because there was extreme irritation in between the toes, that was what was really upsetting the client. She had little micro cracks in between. I don't think we've got a picture of that. I put her into the Lunula, one session every 4 weeks, just because we didn't know how the skin was going to react. Then I would simply hover the laser on the plantar aspect of both feet, like really, really quickly. And it's obviously the light that helped the skin to turn over. We did refer her to dermatology as well, but of course they always for plantar feet they always send a steroid cream, and that was just making the skin so thin. So eventually we just continued with the Accelerate, just a really, really light setting, and bringing her in for the exfoliation. And that's 1 month after the first laser session. So obviously the skin had turned over twice. It takes, at least 2 weeks for the skin to turn over, and it's a perfect result, and it looks so much better. So Zuki, so I'm a partner of this company, and I absolutely love it because internally it does support what we're doing in terms of trying to treat the fungus. And so fungal nail infections, they're treated with antifungal medications, but these can have side effects. So these notes and this advice is from the head of nutrition. Her name's Sarah. So she's the one that actually suggested, look, if you can't put your clients on oral antifungals and you don't want them to be put on them just because of the extreme toxicity, get them to take some collagen. If the nails are damaged and weak, get them to take some collagen. It supports healthy nail growth. And they do a gut biomizuki. I would really recommend this product. So if your client presents with more than 4 nails that are fungally infected, it's very, very likely that they have something going on in the gut and it's not just trauma related. So there's no harm in putting them on this. It's just going to balance out the bacteria. The collagen actually helps the nails to grow really quickly. And collagen peptides strengthen the nails, improve growth, boost keratin production, and it does make the nails more resistant to damage and reinfection. So I do recommend these products for anybody that's suffering with a fungal nail, or also tinea pedis as well. So with the collagen Zuki, you do have to be a bit careful with diabetes, because even though it doesn't have really nasty preservatives in it, can sometimes spike the glucose levels. So you do just have to make sure that the doctors are okay with clients that are diabetic going on this, but we've had great results. Okay, so the Accelerate non-thermal laser. So I'd like to just speak about that. So we've covered the Lunula, and I know that there might be some questions, so I'll get through this quite quickly. So we see many acute and chronic foot conditions. It's proven to be effective for us in stimulating healing, relieving pain, reducing inflammation, and restoring function. So the reason why I love this machine, I I hate to think of clients having to take, you know, quite harmful non-steroidal anti-inflammatories for foot pain, because not only can they get addicted to it, it's only putting a plaster on something, it's not actually treating the pain. So the way that this works is through light absorption. It does emit specific wavelengths, and I've got this information from Erchonia's brochures. Stimulates complex IV, and that plays a crucial role in cellular respiration and ATP production, which you need for more energy for cells to repair, regenerate, and function properly. So I have found that clients can come in, you know, let's take, for example, a plantar tear or a Morton's neuroma, which is very, very painful. And using the Accelerate on a dermatome, or I think you call it the acute setting. So this is the newer model just up here. So I've got the older model, so I think it's called something slightly different. But hovering that on the area of concern for around 2 minutes, that gives the client a lot of relief. And you can actually see and feel any stiffness caused by inflammation. You can see that go down. But again, it's all about compliance. It depends if you have an acute or a chronic injury. But for something like Achilles tendinopathy or tendinitis or tears in the Achilles, that's such an avascular part of the foot that you want to make sure that they're coming in for at least, I would say, once a week for at least 6 weeks, just to get those results. Offloading as well is really important for foot injuries. I don't always recommend orthotics. I go down the kind of foot function strengthening first, but at the end of the day, if something's been injured for quite some time, you need to offload the area, get the inflammation down with the non-thermal laser, with the Accelerate, get them to do some foot and ankle strengthening, and actually you get great results. And clients get impressed when you have the latest tech and technology, because it's, in a way, it's good service. It's offering them options. We do have shockwave as well. And I have combined shockwave and laser, and I've been able to get really good results with plantar fasciitis and plantar fasciopathy. Okay, so the reason I'm showing you this particular client is because she presented with metatarsalgia and she had ankle pain. So there's medial ankle pain affecting the right foot, bilateral shin pain. The feet there was transverse arch collapse. The reason why we're putting her in here is not because she has a fungal infection, but it's because of the pain that she was getting in between the metatarsals, because there was intermetatarsal bursa. And she had a plantar tear. This client likes to run. It's quite difficult when you have the active clients, because even though you would recommend that they rest a little bit, they may not. And she'd been running on this for quite a while, so I'm just going to let her go into it. Okay, just a second. So we've got Kira in the Lunula because Kira has been suffering with a little bit of metatarsalgia. So we did find in the assessment that there was a bit of inflammation in between the metatarsals. So Kira, in general, there's a couple of conditions going on with the feet, which made me a little bit apprehensive about you doing the marathon. But how are you feeling now? So you were in a lot of pain when you first came, and that was just over a month ago. But tell me how the laser has helped your symptoms.
Yeah, I mean, I think for me, I was probably in pain for a number of years, pushing it to the point where I shouldn't have been. And the quality of life has just dramatically increased. I mean, just walking to work would be painful. Right. And now I can just go about my day and not think about it, switch off these other things, particularly this, which just solve the problems, and I don't need to even think about it. So yeah, the pain is pretty much gone at this point. It's pretty good.
That's really good. Oh, that's really good. Thank you so much, Kira. Okay, so that is a real case, and she was able to complete the marathon, and I was quite happy. We offloaded her, she felt better, so that's really good. We're just going to go to the next slide. Okay, so not only did we do some Lunula therapy for oh, just bear with me, for Kira, but we did do some targeted accelerate pain relief in combination. So just showing you that now. Yes, we want to get some movement in there and then just let it drop. Perfect. Okay, so really important when you're using the accelerate, particularly for chronic conditions, that you get the client to move up and down. So we're just going into the medial aspect of the malleolus, and we're just getting full contact where Kira's feeling a bit of pain. Okay, so I'm just going to go over to the next slide. Okay, and we also look after dancers, and the reason why this is important to show you is because you might not see a client for a short period of time. It might be ongoing care.
Hello, my name is Olga and I'm a professional ballroom dancer. So I came into the clinic to take care of my feet. I'm doing the cold laser for bunions. I feel so far it's very helpful. I feel like inflammation come down and I still can dance. I would recommend it to everyone who are in active lifestyles, who are walking a lot or working out a lot, who are using the legs and the feet a lot.
Okay, so for Olga, she's a dancer, so she always has to be on her feet. The toe box is very, very narrow. So the amount of Lunula sessions was 1 session every 4 weeks, and then we do monthly sessions of Accelerate combined with Lunula, and that's just to keep the inflammation down. So she's got moderate hallux abducto valgus, which is very painful. There's always a bursa in that joint. What we're doing, we're aiming to disperse some inflammatory cells that are causing a bursa. So bursitis is inflammation of the joint back, and it's usually related to overuse, and so we're just relieving the pressure and aiming to disperse some inflammatory cells by using the Accelerate. This is a cold laser, so it doesn't actually produce any heat, and the results have been fantastic. Okay, so that's Olga. And then we've just got another case of tibialis posterior tendon dysfunction, plantar fasciitis, and chronic ankle instability. So functional pain scale before 3 sessions of laser was 8, and then we were able to get the client down to a functional pain level of 2, which is really good. So as we can see, pes planus foot type, it does mean that the plantar fascia is in contact with the ground all the time. You're getting micro tears potentially in the fascia, you're getting inflammation. So at this point, when the feet are so sore, when you apply the laser, instantly the client will feel better. But again, it's all about making sure they're doing foot rolling, that they're doing some tiptoe exercises in order to reduce pain and improve symptoms. Okay, so just showing you a little bit of the movement that I was referring to. This is how you want to be using the Accelerate, okay? Down, down. Yeah, this is really good for the soleus. Up, down, down. Okay, and again, more movement.
You do this
Yeah, I do know, it's okay. And strengthening the feet with some heel walking. Slower. Improving proprioception as well. Okay. Okay, so this is me just using the Accelerate all over the rear foot to reduce discomfort. And severe hallux subductovalgus and fat pad atrophy for a 58-year-old scientist. Sorry, there's a typo there. Should be atrophy with an R. Sorry about that. So Sandra's main complaint was extreme heel pain in the morning. She doesn't live in London, so she used to travel in, and she needed a walking stick. She does have rheumatoid arthritis, okay, so there's lots of fat pad atrophy. There's that kind of bilateral subluxation of the joints. So her functional pain scale, so this was a case that was quite tough because she entered clinic, she was referred to me from a physio, but she was in tears. So I'm really glad that we're able to help her. I'm just going to play. Hi Sandra, you have come to see us for the foot lift. You've had cold laser for some inflammation in the feet, and you've also had Lunula laser for your nails. Tell us about your experience. How has it been feeling?
It's feeling so much better. And I think I would say about the process is nothing to fear at all from that. It's completely comfortable. It's lovely. And my feet now are just pain-free compared to what they were. I used to really struggle when I would get out of bed in the morning in particular, and just walking around, because I do a lot of walking. But now they feel so much better, particularly after I've just had the treatment. It's a real treat to come.
Okay, I'm just conscious of time, but yeah, she feels much better. I have used the Accelerate on anterior knee pain, but I've only ever used it once I've got the diagnosis and the client has gone for an MRI. So medial anterior knee pain, unable to play badminton, plank or lunge. So there was a meniscal tear and a posterior cruciate ligament strain, and there was also some patellar femoral tendon involvement because the client wasn't able to straighten the knees properly. So I did refer this client to a physio as well, and we both kind of worked together to get him to a pain-free level. But there was a functional pain scale of 7, and we managed to get him down to a 2, and that was again using the Accelerate on both anterior knees, getting him to strengthen the quads. And also we did get him to wear some compression leggings when he was going to the gym, and that kept the swelling down, which is really good. And pain in the ball of the foot. So it's 58-year-old retired business director. Quite a tricky case because you couldn't even touch the foot because of neuroma. And the one thing I don't like to do is refer to surgery. I like to try everything, but I was thinking about surgery for this client. So the symptoms were present for over 1 year, but this particular client does like to wear narrow shoes. So the functional pain scale before the Accelerate was an 8. We managed to get her down to a 3, and we treated Betsy with 3 Accelerate laser sessions 1 week apart. And we did combine this with 5 minutes of the Lunula laser. So we'd start off with the Accelerate, then we'd laser the metatarsal heads for around 5 minutes with some movement. We did make her some orthotics. We got her to take some collagen. Why? She's perimenopausal, and there was a little bit of reduction in the fibrofatty padding. So obviously when you're walking on the metatarsal heads, that's going to be quite painful. So the collagen does help with general lubrication, and it really does help with pain because there's vitamin C in there as well. And we got her to do some foot strengthening exercises, and she's got some words to say. Hi, Betsy.
Hi.
How are you?
Very good today, thanks.
Good. Happy Women's Day. So we've been looking after you for a neuroma affecting this foot. We also had intermetatarsal bursitis, which was giving you pain in the forefoot. So we've been giving you laser. You've had some orthotics made. And how are you feeling now?
As we're going through it, I am feeling much better now. I am seeing the improvements. The pain is going away on the hikes. It is just working significantly better than where we were.
Okay, so yeah, she does go on one. I can send you this presentation, but I'll just get on to the next slide just because I'm conscious about your time. yes, the reason I wanted to show you this is because we achieved some great results. This was discoid eczema. So this is the type of eczema that can very quickly turn into an ulcer because of the extreme irritation that it causes the client. So the medical history is that this particular client was very healthy and she did go to the gym, but the feet were severely water retained. So she has had eczema all of her life, but every 4 years she explained that she would get these patches. So initially I was kind of just treating it as a superficial wound. I would apply Inodine, that wasn't working. And then I would bandage the area, do the weekly redressings. I advised her to take some collagen because that's great for skin and nourishing the skin. Vitamin D levels were low, and she told me that because she went for a blood test. She did need antibiotics because there was some staph in the first picture that I'm showing you. You can see the inflammation. So I asked her to go to the GP and I wrote a referral letter and we were able to get her some antibiotics. But what I did was there was itchiness throughout the whole foot, not just the medial malleolus, which is what that area was, but I put her into the Lunula just to generally cleanse the feet and cleanse in between the toes. And 1 week after the third Lunula session, we started to get great results. But after the Lunula, we would hover, not so close, but we'd hover the laser around the area with and without the dressing on, but with the handheld laser not touching the skin. And we'd do that for about 3 minutes. And what we're with like a bit of a gap in between, and we were able to get great results. And I think the Accelerate would have helped to improve the circulation around that area, but also it did help with the irritation. So you can use it on the skin, guys, especially because it does, improve mitochondrial activity. So that's always going to be beneficial for skin conditions. Okay, so I'm very pleased because I was able to treat somebody that happened to work for Women's Health. And she did have a real injury, and I wish we had her video. I should have incorporated that into the presentation, but she had extremely painful feet following having a baby, and we found out that she had a plantar tear and there was just chronic ankle instability, and she hadn't heard about this. We tried it. We got her to strengthen her feet. After the second session of laser, she advised that she worked for Women's Health and she's going to write about this because she couldn't believe it. So yeah, we were able to get our name and the Accelerate and the effectiveness of that into Women's Health, and that generated loads of interest for women that just had babies. So it helps many different client groups. Just recently did an article for Health. It's all about getting the feet stronger. It does touch on the fact that we would refer and recommend laser for real chronic injuries. And again, I was this is a journalist who had a genuine injury, and we were able to treat her for Achilles. It was tibialis posterior tendonitis and tendinopathy. She did have some plantar fasciopathy as well, and we were able to get her into the marathon. That went into the Standard. Again, these articles, because they're real cases, and especially if they're documenting them on social media, they will generate lots of interest and you'll be able to help a lot of people. Okay, so yeah, I'm very pleased that we were able to get our name in the press. So we've come to the end. I know I've rushed through, but I'm aware that there are some questions. So I do appreciate your time this evening. Thank you so much for listening to the webinar. I hope that I've been able to show you that podiatry doesn't have to be cut and file, you can, and you have a great degree to be able to diagnose and treat an array of different foot problems. I'm in Soho, and I think there's another podiatrist that does Lunula, but I don't think there's another one that does Accelerate. So you're getting busier and busier because you're providing a unique service. And again, with these machines, because it's the latest technology and you're combining it with everything else, you will get great results and you'll get great reviews, and people will come back, and that just gives me the best satisfaction. So for the Zuki products, if you do want to order some, or if you want some samples, you can email me and I can get some samples sent to you, but you can put the code in and you can get 20% off. I recommend that every clinic has them. They're all, I think they're FDA cleared, and they're also really good for vitamin C. They're in Selfridges, they're in all of the health shops. Doctors even recommend collagen now for people that are needing hip replacements. You can email me if you would like to. So if you go to info@footlift.co.uk, I have a team that manages the emails, but if you want to speak to me privately about anything or ask me anything, then you can. Simone@footlift.co.uk. You can check our website out, and you can follow us on Instagram and on LinkedIn. I'm always really happy to chat about laser and my experience with the laser. And thank you so much, guys, for listening this evening.
Thanks, Simone. That was brilliant, inspiring. And what I always loved about you, and I don't want to embarrass you on this call, but obviously there's always a place for conventional medicine, but
Yeah.
there's also a place for looking outside of the box, that something that conventional medicine can't provide. Because I think now in the year 2025, there's a lot of clinics looking at biohacking and all sorts of different ways to try to get from A to B. And the technology is changing all the time. And I think every patient you see, you don't look at it from a conventional viewpoint. For example, it's one Lunula treatment a week for 4 weeks. You look specifically at what you think that patient specifically needs.
Exactly.
You understand the mechanism of action, you know how it works. So you want to give the patient's body time to actually make the intracellular changes, see how the body responds, and then you create the treatment pathway from there. So thank you very much for that. There is some questions, so I will go through them. One is, what is in the hydrating nail drops?
Yeah, of course. That's a great question. So there's tea tree, and there's almond oil, there's spearmint, and there's lime. So these are all natural antifungal products. And the almond oil will help with nail growth. The tea tree will help with fungal contamination. The lime will help with bacteria. And in general, what you're doing is you're trying to create a cleansing but a hydrated environment for that nail to grow through. So they are available on our website. We do sell out of them all the time. And even if you use them on your fingernails, the nails just grow really healthily. And that was a product developed just over 5 years ago now.
Brilliant, thank you. The next one, what do you use for medical exfoliation?
Yeah, absolutely. That's a great question, actually. So we do dry exfoliation, okay? So we use a foot file. So there are replaceable pads that you can get for foot files now, and I would not recommend the diamond ones. Why? Because if you put those in the sterilizer, they get really blunt. What you need is something that easily rips off. That's a stainless steel, and you can put the stainless steel foot file handle in the sterilizer, and then you replace that with the exfoliating pad. And what I would do is I would just apply loads of alcohol to the feet, minimally debride, and obviously don't wet the feet, and then you'll just give the feet a really good file. And if the client's coming in for a foot lift, we have our collagen mask, which we sell to clinics now. Actually, we've started selling this. We paint that all over the skin, and you get really fantastic results.
Brilliant. Next one, how did you hoover the laser on the plantar aspect? was the patient supine?
Yes, exactly. So what you do is you get the client to lay down flat. You then put the client's foot inside the laser, and even though the feet are in a dorsiflex position, even though the kind of lights are going in a different direction, you're still able to get a little bit of the light and it hits everything. And I've used that method for a couple of clients, especially for clients that are unable to sit down. So get them to lay down, you bring the Lunula up to the couch, and the weight of the foot you'll stand behind the laser, and then you'll just press start. So yeah, you can lay the patient on their backs.
Brilliant. Mirella from Romania, I would like to know how you place the foot in the Lunula in cases of plantar psoriasis.
Plantar psoriasis. So I think that was for the case that I shared was that for, yeah. So for both of those clients that had the dermatological problems, you would get them to sit down, okay, and you put the foot inside once they're sat down. That will hit the interdigital spaces. Then you'll get the accelerate and hover that on the plantar aspect. And again, you can get the client to lay down on the bed, and you put the Lunula up on the end of the couch, and then they can lay down, and you can have a session of laser like that. I don't recommend that for clients that don't need it though. But I've got really good results, and I'm happy to share. If you email me, I can share pictures of exactly how I do that and videos of how we do that.
Great. Let's have a look at this one. This one I can probably answer, but you can add to it as well, Simone. It just says sort of many podiatrists are familiar with traditional infrared lasers. Obviously, systemic medications, topical antifungals for treating foot and nail conditions. What is the main difference between this? Now, obviously, we've gone through this quite a lot over the years. It's about the photochemical against photothermal. If you're able to generate the necessary amount of electron volts per photon into the body, you can, into the mitochondria of the cell, I should say, you can create a photochemical response within the cell. Now, if you can't generate that amount of electron volts that you need, then the energy comes into contact with the water molecules, it makes them vibrate, and it turns it into heat. So that's the difference between photochemical, which works more like a drug biologically, and photothermal. But traditional treatments tend to focus primarily on eradicating the fungus, but fail to repair the nail structure and improve the circulation, or enhance long-term nail health. So that's the most holistic way of looking at it, which I'm sure you would agree, Simone. But the non-thermal laser works like a Lunula, or even like the the Accelerate. It works through the photochemical stimulation. So it's not heat, it's just making biological changes at a cellular level. And the infrared type lasers generate heat to damage fungal cells, and non-thermal lasers stimulate the body's own repair mechanism. So that's predominantly the differences.
Yeah, I could have said it better myself, Simon. Thanks. Yeah.
Sorry. Right, with the Accelerate laser for acute pain, is the relief instant or delayed?
So it depends on what the condition is, but if somebody presents with, I don't know, very painful plantar fasciitis, as soon as you palpate that heel, they're in pain. I have honestly achieved instant results. However, it's not to say that it's never going to come back. They have to come back a week later, because that pain will return once the swelling kind of starts to come back. But I have experienced instant results, and clients get really amazed by it, because oh my gosh, it doesn't hurt anymore. And that's because you've just dispersed those inflammatory cells. So yeah, in chronic cases, for example, if somebody's got fat pad atrophy, they've had a stress fracture, their feet are always sore, they're wearing the wrong footwear, it may take at least 3 sessions before you start to see any changes. But you will get a result. And the worst thing that can happen is, look, I mean, the worst thing that can happen is nothing. I mean, you're not going to do any harm by trying the laser, and would rather that than putting clients on, as I said, paracetamol, ibuprofen, non-steroidal anti-inflammatories. You want to actually make a change in the mechanics of the feet, and also you want to change the cells that are affecting the injury, because as we know, after a while your body doesn't have the energy to continuously try and heal a problem, and that's how you get chronic foot pain and chronic ankle instability. So this just allows the body to do what it needs to do. I don't know if you want to add to that, Simon.
Oh, I think you've hit the nail on the head there, with your last statement especially, because I think all of us as human beings, you know, when we're born, we have everything that we need in our bodies to live a normal and healthy life. But as time goes on, unfortunately, we sort of lack the inspiration, and we all know that's predominantly down to bad lifestyle. It could be down to, you know, preservatives and additives that we get in foods, which affect things like our gut and our ability to heal ourselves. So we get to the stage, you know, I had a bilateral knee replacement in September 2023. And at the 6-week stage, when I went to see the orthopedic surgeon, I had 125-degree range of motion. And he didn't think that was possible. And I didn't want to come across as arrogant, but I said, well, I'm lucky enough to run a non-thermal laser company. And I explained what the differences are between high energy, low output lasers and the high power lasers. And I said, you know, my body had everything it needed. It just needed a bit of inspiration. So if I was able to rejuvenate my cells, make my mitochondria more viable, put myself in a better position to fix itself while, you know, also, you know, increasing circulation and reduce inflammation. And I used it. I was lucky enough I've got one, and I used it, you know, a couple of times a day. And that was the main reason why I recovered so quickly, and why I suppose I had the confidence to have a bilateral knee replacement rather than have the knees done individually. So it's just, you know, to, you know, inspire our bodies to empower them to be able to fix themselves. So I suppose you could look at it as if the laser isn't actually doing anything. It's just giving the body what it needs to actually fix itself. So, you know, I think that's the main thing I would add to that. I'm conscious of time now as well. So the last question come in. Simone, what advice would you give to anybody looking to integrate non-thermal laser therapy into their treatment protocols? So I don't know if you want to start with Lunula or the pain lasers.
Yeah, I mean, I think that you can integrate it quite easily. So it depends on what kind of clinic you have. But if it's easy to integrate it, but I do think that you should, sorry to talk business, but you should charge a separate fee for it. So you should do an add-on. So for example, if somebody's coming in for a biomechanical assessment, I'm going to assess them. But if I establish that they have heel pain, I'm going to suggest that they come in for 3 sessions of accelerate laser, and we'll do some foot strengthening exercises. I might get a physio to have a look at you as well. But it's really easy to integrate when you explain what the laser does, and that you explain that there are settings that have been formulated to treat specific conditions. But if I would suggest that you don't worry at all about, you know, maybe if you're not that confident with anatomy or biomechanics, you don't really need to be. If there's pain, you can just hover the accelerate over for the first session over the area, get them to walk around, and literally you're shining the light on the area of pain. And for Lunula, it depends. If your client comes in with itchy feet, fungal nails, interdigital tinea pedis, you can do, you know, your routine foot care absolutely fine, making sure you're cleaning those feet perfectly well. But then what you can also do is say to them, look, we do have a treatment for this, because we can treat this for as much as, you know, you want us to. But if you want to look at treating and improving the appearance of feet, we do have the Lunula laser, and you stick your foot in there, explain what it does, explain that it has violet light, which has antibacterial properties, and you stick your foot in there, and it does improve the appearance and reduces risk of infection. And that's how you can easily integrate it. And once you're confident in explaining that, people will just start talking naturally, and then you'll become, you know, really successful with it, especially as you continue to use it. And I hope that answers your question.
No, I think it does. And again, it goes back to what I said before about looking at these things holistically rather than, you know, a robot that just sort of puts a foot in a device, for example, and does 4 treatments and off you go. It's to try to look at the skill set that you currently have and the education and the knowledge that you've got. And the Lunula, for example, is a very important part of the program, but it's not the only part, and it's not a miracle. It's not going to always just cure it by itself.
Yeah.
You know, it's key to look at lifestyle, look at how the patient is actually living, look at a wide variety of different things. So look at it holistically, which I think you actually said. And with the pain lasers, you know, exactly the same. You know, most patients notice an instant response. They notice an instant response to pain, but you know, the brain's maybe so, especially with chronic conditions, the brain's associated the pain or the body with the pain for a long period of time. So you can't just do one treatment and expect it to go away. It's sort of providing, I suppose, a smoke screen to the brain, so it sidetracks it so you can actually get to repairing the condition. So keeping the pain away for a longer period of time and eradicating it slowly but surely revolves repeat treatments. And then it gets to the stage, I think, of treatment where the brain doesn't recognize pain anymore, and you know, it just recognizes the fact there's no pain there. So, no, brilliant presentation, Simone. Somebody's actually just sent a message saying excellent presentation. The last one, which you can answer, I can look at it as well, but because we've done some research on this. Have you tried Lunula on plantar warts? Now, we were doing some research on it, but the problem is, you know, it's a viral infection, you know, a plantar wart, and we are normally looking for an immune response with the Lunula or any of the other lasers. So because it's viral, it's not visible to the immune system, but we have quite a few clients, for example, who maybe cause small trauma to the plantar wart, then use either the Accelerate, the Lunula, or the EVRL to dissipate the problem. But it's a case of trying to make it visible to the immune system to get that response. Have you got anything to add to that, Simone?
Yeah, I think I would suggest the same. I think with HPV and plantar warts, I would look at debriding it as much as possible first, and then using the handheld on it. But I haven't used it for, I haven't used the Lunula for HPV and for verrucas, because we're quite good with debriding it, doing some cryo, and it tends to go away. But also, if it doesn't, you tell the client that this is an immune response. We can try it, but it may not work. But it's not a bad idea to trial it. If I get stubborn verrucas, then I may try it, but I can't say that I have, and that I have had results with the Lunula and verrucas. But
yeah, we had an Australian podiatrist who did a study on it, looking at all of the lights, and he got a really good response, but it took too many treatments. So we didn't think that was commercially viable enough to launch it for that. But I know we've got a lot of customers, for example, who would, you know, use some of the acid that you use to try to traumatize it, needle it, just to try to make it visible to the immune system. Then either use the handheld, or if it's at the bottom part of the foot, you know, put the patient's foot within the Lunula, and we get some really good responses. But again, you know, like most treatments, combination therapies are always the best way to go. And I think the laser can play an important part within treating that, but not the only part.
yeah, definitely. I completely agree.
Brilliant. You look as though you might want to go for your dinner now. So, and everybody else probably feels the same. So I can't thank you enough for coming on and sharing your experiences. Lunula is something that we've promoted for a long time, but the pain lasers we've predominantly more gone to, you know, chiropractors, physiotherapists, sports clubs, cosmetic doctors. And I just thought that, you know, you've proven that the Accelerate can be a hugely important part to your practice. And I think it's something we should be promoting a lot more to in the podiatry industry. So thanks again for sharing your vast knowledge and expertise.
Oh, you're so welcome. And thank you so much for tuning in, guys. Have a good evening. Simon, take care.
No problem. Thanks, Simone. Everybody will get sent a recording of this presentation So enjoy and ask any further questions, and we'd be more than happy to put them forward to Simone. Thanks, guys. All the best. Take care.
Thanks, Simon.